Hello, everyone, and welcome to our discussion tonight on neuromodulation. I'm Dr. Jessica Ilani, the director of the MedStar Georgetown Headache Center in the Washington, D.C. area. I'm joined today by a good friend and colleague, Dr. Stu Tepper. Stu, why don't you introduce yourself to our audience?
Hello, I'm Stu Tepper. I'm Vice President of the New England Institute for Neurology and Headache in Stamford, Connecticut, and I'm a professor of neurology at the Geisel School of Medicine at Dartmouth in New Hampshire. And we're going to talk about non-invasive neuromodulation devices for headache and try to show you as many of them as we can. And I think that I'd like Dr. Ilani to start off by sketching a few warnings and concerns as we get very enthusiastic about the devices. Dr. Ilani.
We thought we'd start with a couple of warnings because we always do get very excited talking about non-medication options for our patients. And I find that often I get so involved in talking about this with my patients that I forget the warnings. And so we thought we'd start with the warnings. If you do have a history of a seizure disorder, if you have other implantable devices in your body, most big example is a pacemaker, if you have like a shoulder implant or a hip implant of any sort, these are important to bring up with your healthcare provider if you're considering a neuromodulation device, because they might be a reason not to use one of these devices, even though they're not implanted. I will tell you, all of your healthcare providers care about you, know your medical history, but sometimes someone like myself who's really just taking care of headache might not remember that you used to have seizures over a decade ago. It's a good idea to just remind them again, hey, I used to have seizures. Do you think this might be a problem for me to use? Is this a problem that I shouldn't try it? And just bring that up again before talking about any of the devices we're going to discuss today. Another thing I wanted to mention is, when do I talk about these devices that you're going to hear a lot about in the next 40 minutes or so in clinical practice? Well, I talk about devices anytime a patient tells me they've had side effects to every medication they've tried. They're worried about medications. They want to try something different. They want to try something new. They want an alternative to their standard medications, or a patient who has very frequent migraine attacks and they want to try to take something, not a medicine every day, to treat every single attack. And these devices generally are safe to use frequently. Many times I'll tell my patients to use them daily, especially if they have near daily headaches. And so these are definitely the types of people I'm thinking about and talking about devices in clinical practice. Most important though, most of these devices are not covered by an insurance plan, so it's something the patient will have to be comfortable about. Hey, this might not be covered by insurance. Are you still interested in having this conversation? So knowing some of those, big pointers that we have to talk about before we get into it, let's get started with our devices. So Stu, let's have you first talk about the Cephaly device.
I'm going to do that. Before I do, I just want to say, what we're going to do is to talk about very specific FDA-cleared non-invasive neuromodulation devices, one after another. And there are no studies that compare these devices. So some people make the decision based on cost and some on convenience. All except two have an FDA designation of a non-significant risk device. And that means that with the exclusion of the few things that Dr. Ilani mentioned, they won't have significant side effects for you. You will feel them, but you probably be able to tolerate them very well, but they won't have significant side effects, and they don't have side effects that interact with medication. You can add them to medicine, you can use them alone or with medication, and at the end we'll come in and talk about appropriate people for use of these devices, but they are by and large very remarkably safe and very remarkably tolerable. 3 of them are actually FDA cleared for use in teenagers from 12 and above, and as well as in adults. A few of them have only an indication for the prevention of migraine or the acute treatment of migraine, but most of them break down the wall between acute and prevention and work on both. Some of them have different programs for both. So with all of those preambles, let's talk about the very first non-invasive neuromodulation device that was FDA cleared, and that is called the Cephaly device, or an external trigeminal stimulator. And this is what it currently looks like. And when you buy it, you do not need a prescription for it. You can go on the Cephaly website and order it. It generally costs about $400, and I'll be talking about costs later. And then you also have to buy 3 electrodes. These are sticky electrodes that peel off the plastic back, and when you're done with the treatment, you put them back on the plastic back. And if you baby them, each one of these electrodes can last for about a month. So after 2 to 3 months, you're going to need to replace the 3 electrodes. And the way the Cephaly is actually put on is that you peel off the electrode, put it on the forehead above the eyebrows, and the Cephaly device has magnets at the back, and the magnets attach to the sticky pad, which is the electrode. And then you turn the Cephaly device on, which I will do here, and it should turn on, but it's being a little difficult. Anyway, when it turns on, a light comes on to tell you that it's on, and there are different programs for Cephaly. One push of the button will activate one program, 2 pushes of the button activates another program. One program is what you put on to stop a migraine, for the acute treatment of migraine, and that lasts an hour, or you can repeat it and go 2 hours, and for some people 2 hours works better than 1 hour. And then a daily or nightly use of Cephaly for 20 minutes nightly is preventive for migraine. And when one turns on the prevention program on the forehead and it turns on, you'll feel weird feeling as the stimulator or the neuromodulation device is activated, and it ramps up over the period of time of stimulation. And that can take some getting used to, let's put it that way. And eventually you get to a point where you can tolerate the full 20 minutes and do that every night. And I tell my patients, you want to do the full stimulation, 20 minutes nightly for prevention of migraine for 3 months, and to get a feel for whether it's going to work or not. Cephaly offers a return. You can send it back within 3 months if you didn't tolerate it, don't find it in any way effective. But remember, it works both for acute and preventive use. And the disadvantage, of course, is cosmetically, it's a little weird to have a rhinoceros horn on the front. But if you're at home, you can use it both acutely and preventively. It does make people feel relaxed. And so we recommend that it be used in the evening. It turns off automatically at the end of each program, so you're not going to burn yourself or have any other problem, which is why it's a non-significant risk device. There is a second device which we hoped to show you, but it got stuck in the mailing from Canada, called Headiterm. Headiterm looks very similar to Cephaly. It's less expensive. It's $99 for a rechargeable Headiterm device. The Cephaly device is rechargeable. It has a little stand that one puts on to recharge it. So both Cephaly and Headiterm are rechargeable devices. They both work the same way on the forehead. They're both FDA cleared. Headiterm is cleared only for acute treatment, not preventive treatment, or vice versa. I always get mixed up. But with Headiterm, it doesn't ramp up automatically. The person who uses it has to set the level that is comfortable, and it only goes 20 minutes. So if you're going to use it preventively, you would repeat the 20-minute prevention or do it every night. If you're going to use it acutely, you would repeat 20-minute treatments acutely to terminate an attack. So Headiterm, we're using it quite a bit now because it's less expensive than Cephaly. It's available without a prescription, and it requires a little bit of a different discussion with people about its use. And before I leave these devices, you might ask, well, how do they work? And these two devices are designated by the FDA as TENS units. So they're similar, if any of you are familiar with TENS units on the back. And they do some additional aspects. They do send a signal that turns off migraine or modulates migraine down into the lower brain stem and actually up into the cortex as well. So almost every single one of the devices that we're going to talk about starts outside the head but goes inside the head to do the work. And I'll leave you with one last point about these devices, which is that when we use medications, we are usually targeting a specific chemical or set of chemicals. With neuromodulation devices, we're actually modulating the brain. So we're going after targets that we know about and targets that we don't know about. And that's why they can work in people that have had bad experiences with medication. Having talked about Cephaly and Headiterm, I'd like to turn it over to Dr. Ilani to talk about non-invasive vagal nerve stimulation, beginning with GammaCore.
So GammaCore was the first FDA-cleared device for the treatment of both migraine and also for cluster headache, and is now used for migraine acute treatment, migraine prevention, for the acute treatment for cluster headache, and sometimes people will use it to try to prevent cluster attacks. I will tell you my personal opinion. I find this device, and I'll show you this device, to be very effective for prevention and acute treatment in cluster headache. I also think there have been some small studies looking at this device for vestibular migraine, for menstrual migraine, for just people with vestibular symptoms, for people with gastric issues. I know that the government's been studying this for people with blast syndrome. There's a lot of very interesting things the device can be used for. As Stu mentioned, we're going to get to cost later. The one thing that limits my use of this device at this point in clinical practice, it is extremely expensive and difficult to obtain. But there's a lot of interesting things this device can do. So the device is meant to stimulate the vagal nerve, which goes from your neck all the way down to your gut. And in migraine, we know there's an intimate relationship between the gut and the brain, and this nerve is probably involved in some of that relationship. The device works by, it comes with this credit card type looking thing where all your charge is, and you get one per month. That's what you're paying for when you pay for the device. And you put that charged credit card on the device when it's time to use it. This device, I haven't charged it in a long time, so I can't turn it on for you. Plus, I don't have a card. You turn the device on, you put the charge on it. It comes with some jelly. Where's my camera? Some jelly that goes on these electrodes. And then the electrodes sit on your neck. And it does take a little practice. The first few times you use it, we tell our patient to go in front of the mirror. You have to push on this button to amplify the actual target of the vagal nerve. You want to watch in front of the mirror because you know you hit the right spot when the bottom of your chin starts moving. That's the one motor symptom, the one way you know that you've activated the vagal nerve. If you don't quite get it, we advise the patient, move it over a little bit, move it over a little bit, and you're going to get to just around the right spot when you hit that motor function. It's actually pretty simple to use. Usually patients are able to see that little motion pretty quickly, and it's very well tolerated. Most people don't really feel side effects. Occasionally I'll hear people tell me they have a little bit of dizziness when they use the device. As I mentioned, since it's used for multiple indications, the dosing can be very variable. So it's really important you talk to your healthcare provider if you're going to consider this device and ask, what's the indication I'm using it for? So what is the amount of times I'm supposed to use it, and how often can I repeat it depending on the indication? It is one of the devices that's cleared to be used in teenagers. That's, I think, to me, very impactful. When it's used in children, you know that safety and tolerability is pretty high. So this is one of the devices that does require a prescription. It is something that has to be sent into a specialty location, and they ship it to you, and you have to purchase cards every month if you want to keep using it every month. The nice thing about it, if you're using it for acute treatment, especially if you have cluster headache and your attacks are going to go on for 4 to 6 weeks, maybe 8 weeks, you only need to purchase 2 cards, so that's 2 months worth of treatment, and maybe then you're not going to need to use it for a year or two. You can put the device away, and then when the cluster cycle comes back, if you find it helpful, you just purchase the cards again. And I think that's really helpful for some of our patients who use it, that it's not something they're having to pay monthly for just when they're actually using the device. So Stu, why don't you talk to us a little bit about the TruVega, similar nerve stimulation type device for the vagal nerve, what it looks like and how is it different?
Well, what's interesting about the Gammacor that Dr. Ilani showed you is how many areas, as she said, where it is cleared. It's cleared for migraine, it's cleared for cluster headache, it's cleared for some of the more rare headache disorders, paroxysmal hemicrania and hemicrania continua. In fact, it's the only therapy that's ever been cleared or approved by the FDA for those disorders which respond to indomethacin. So there's a very important need for access to the GammaCore non-invasive neuromodulation device. Right now, the only access is through the U.S. Veterans Administration Health Service. The USVA covers all or almost all of these devices through the VA Headache Centers of Excellence nationally, thanks to the national chief for the USVA Headache Centers of Excellence, Dr. Jason Seco. And if you are a veteran, then access to these devices is relatively straightforward. And GammaCore, the non-invasive vagal nerve stimulator, is used first line for cluster in the VA. But the rest of us, for the rest of the patients, the cost is very high per month. And the company, recognizing that, has a second device which works exactly the same. And every time you activate the GammaCore device for 2 minutes, you can activate this other device for 2 minutes. And I'll show you a few differences. This device is called TruVega Plus. It is not FDA cleared for headache. It's FDA cleared for a variety of unusual things like clearing thinking and well-being. And the TruVega Plus, unlike the GammaCore device, is rechargeable. Costs about the same as the Cephaly device, so about $400. And instead of a goop that one puts on the electrodes, there's a spray that one puts on the electrodes. But otherwise, there's really, if you're not a veteran, there's no reason to be trying to pay for the non-invasive vagal nerve stimulator, the GammaCore, unless you really only get your cluster cycle every several years, in which case paying for the card for a couple of months is reasonable. But you pay for the card for a couple of months, you've already paid for the TruVega rechargeable, the TruVega Plus. So our recommendation now for patients that are not veterans who would benefit from non-invasive vagal nerve stimulation is to use TruVega, is to get TruVega and not GammaCore. So it's a change in the way we're doing it. It's similar to us recommending Headiterm instead of Cephaly. We're looking for less expensive alternatives for devices that work the same. In the case of TruVega, though, it's made by the same company with the same delivery and the same stimulation parameters.
I tell you, I would use any wellness and clear thinking any day. So I've been thinking about getting one of these for myself. That indication really covers quite a broad range of people. But having trouble with clear thinking is a very common symptom of migraine. So Stu has just told me about this device not so long ago, and I'm intrigued and really considering seeing if I can have some patients start it, because I'd like to see if some of the cognitive symptoms of migraine do get better with this device. I think that would be a really beneficial thing for some of our patients who struggle with cognitive symptoms during attack, but also in between their migraine attacks, which can be such a high disability.
And that's a really good segue into our next device, because the next device has also the claim to fame of clearing cognitive fog in migraine. And that is the single pulse transcranial magnetic stimulator, or SAVI-DUAL. This is a magnetic pulsing device, and actually mine got recharged, and I updated it today thanks to the company, and I just turned it on, and while we're talking you can see a little light that's going to go around that center on-off switch. When it gets all the way around, it's going to beep, and that will tell us that the device is ready to use. So it takes as long as I'm talking to you for a boot. And once it's booted, and it's going to come any second now here, let's just wait. I'm waiting to hear the beep, but in any case, once it has been booted like this, the actual discharge of the device is very straightforward. So what happens is it's now ready, and it has little indentations to hold it conveniently. You put it on the back of the head and press either button at the bottom, and it will discharge a magnetic pulse. That's the pulse being discharged. And one can use it acutely or preventively. Again, it's okay in adolescence. And with this device for the prevention of migraine, 4 pulses 3 times a day or twice a day. So one clicks it, reboots it, clicks it again, reboots it, does that 4 times in a row, twice a day or 3 times a day. And then you can use 4 pulses at the beginning of a migraine or at the beginning of aura. And it works very well in all of those circumstances. Again, I have a lot of experience with this device, and it's an extremely effective device. There's no limit on the number of pulses that people can give themselves during a day. As Dr. Ilani mentioned at the beginning, we don't want it used in people with epilepsy or with indwelling devices. But it is it's very effective over a 3-month period in the prevention of migraine and the acute treatment of migraine, and has virtually no side effects. Some people do feel the pulse of the magnet when it is discharged. And what it does inside the brain is gradually modulate the pain pathways. So the SAVI-DUAL STMS device, which is available at the VA, is an extremely effective and useful device in the acute and preventive treatment of migraine. The drawback for it is the price. So the very first question to ask is, for a practitioner, is, are you a veteran or are you independently wealthy? And with those, if either of those questions are yes, this can be a very, very useful device, and has very good evidence for effectiveness. It's the only device that we have that modulates by magnetic pulses, and that differentiates it from some of the other devices. And now Dr. Ilani is going to talk about taking what we do with this Cephaly device and the Headiterm device in the front and adding modulation at the back. And by the way, before I forget, we are perfectly willing to answer questions at the end of this webinar. So if you want to put them in the question area or the chat, we'll try to address those when we're done going through all of these devices. Dr. Ilani, tell us about Relivion.
So this is the Relivion device. It is what I call the front back device. It is a neuromodulation device that stimulates both the nerves in the front here, the supraorbital, supratrochlear, and also, so these are branches of the trigeminal nerve, which is very involved in migraine, and also stimulates the greater occipital nerve. So this is important because when the Cephaly device first came out, what we kept hearing about is, well, this works, but it would be awesome if I could take this device and flip it around and put it on the back and also get stimulation back here. So patients really seem to like this device a lot. So I'm just showing you the external parts of the device. Here's a little magnet that makes it stick together, so you can see the inside has a nice little foam cushion, so it's not going to be hard on your head. This, I think, is especially important because these areas tend to be very sensitive. When you have migraine, the nerves are very tender. It has this nose piece that sits, I'll put it on in a second, but just to show you, and these little soft foam parts in the middle. There's a button in the front that turns it on, and there's a way for you to turn how strong the device is up and down, which you can do at the hand, just with your hand. Now these pads here do need to be kept wet, so sometimes a little complicated if you have hair, but they have changed the technology a bit so that it does work better, knowing that most of our patients are women. Nobody's going to be shaving their head for this. So it is something you should be able to have without a problem. So trying not to mess up my hair too much, but basically this is how it goes on, pretty simple, and you just press the button to turn the device on. You are supposed to make sure it clicks together in the back if possible, but I don't want this to get stuck and then make a mess coming out. And actually got my bobby pin. It's a pretty good magnet. So again, this is the Relivion device. It is prescription only. It is actually currently FDA cleared for acute treatment of migraine, but you can also use it. I tend to tell patients if they're going to get this device to use it every day for a longer 40-minute time period as a preventive. And I tell them to time it. Usually, like Stu was saying earlier, it is a bit relaxing to use the preventive part at night. And if they have an attack earlier in the day, they can use the 20-minute time period for acute treatment. So it can be helpful that way. Again, we'll talk about pricing, but it's a little bit more expensive than some of the devices, but less expensive than others. So it's kind of this middle ground. And they do have this really nice app program that it comes with that you can keep your calendar, and it actually tells you how you're doing, how well you're doing using the device. Have you been compliant using the device? When you say you have a migraine attack, are you actually using this device or not? And your provider who prescribes the device can actually log in anytime they want and track how you're doing. So say you forgot your headache log during your appointment, they can actually log into the site, and if you've been tracking every day, they can actually take a look at how you've been doing. So I think that bit is nice as well, giving you information about how your attacks have been doing. Have they been changing since you've been using the device? Has there actually been a decline over time in how things have been going? I find this particularly helpful for my patients with chronic migraine because they have frequent attacks, and it's a nice device to be able to use on a daily basis. But of course, that doesn't mean it wouldn't be effective for patients with episodic migraine. It has not at all been studied in patients with just occipital neuralgia, but it's definitely another patient type that I consider it in, especially if they haven't found a medication to be effective or they're having a lot of side effects. Though they still get the front stim, we don't have a single greater occipital stimulator at this time, so I find it a nice way to get the stimulation of the occipital nerve without having a surgical technique done. So it's another patient population not studied, not indicated for, but I would consider for this type of device. So Stu, unless you had anything else you wanted to mention about the Relivion, we can move on to talk about the last device, the Nourivio device.
No, I agree with you on the Relivion. I like it in people who are coming in for repeated occipital nerve blocks or both. And it was developed specifically so that it wouldn't hurt, like Cephaly can be very unpleasant when people are getting used to it. And there's one little piece of neurology here that's always worth remembering, and that is that when one is accessing pain pathways, the front of the head is different than the back of the head. And the pain pathways in the front of the head are what are called trigeminal, and the pain pathways in the back of the head actually derive from the neck and the cervical region and then go in through the occipital nerves. And so by combining with Relivion, one may get a better response. And now, last but definitely not least, is the device that we're probably using the most in practice. Is that the case for you, Dr. Ilani? Yeah. And in my as well. And this is a device called Remote Electrical Neuromodulation, or Nourivio. So I'm sorry to confuse you with Relivion, which is the front-back device, and Nourivio, which is the Remote Electrical Neuromodulation device. But that's what we're stuck with. So the Nourivio device looks like this. It has a sticky at the back, and one can turn it on. And when it's turned on, a green light comes on to tell you that it is ready to go. This device is controlled with a phone, an iPhone or a smartphone app. And I loaded it on my phone. Nourivio will open it up, and there we go. So what it will do is it has a start button. It has a control that allows you to set the intensity, and it comes with a sticky back, and this device goes on the arm, on the upper arm. It'll stick right on there, but it also has a belt which one puts over the device and over the arm to hold it in place even more strongly. Still, the device with the belt and all can be worn under a shirt. So once you turn it on, you can put a sweater on or a shirt on over it and wear it at work and stimulate while you're doing your activities, which is very nice. Now, the way the device works is very different than the other devices. And the way it works is based on an old understanding, and it's kind of an odd one, that pain in location A in the body can turn off pain in location B in the body. Pain in one area can turn off pain in the other area. And this device, what one does is the first time you take it is put it on the arm and turn up the stimulation intensity until it hurts, and then bring it down just below where it hurts. You don't want it to hurt. You want it the maximum buzzing of the arm that doesn't hurt. That's the stimulation that fools the nerves into thinking that it's painful when it's not. So this very high intensity buzzing will turn on the pain signal in location A, which is the arm, and turn off the migraine. And the usual stimulation is 45 minutes. And the device can be used at the beginning of a migraine, preferably the earlier the better. You turn it on, you've already picked the intensity that you're going to use, which is not painful. Turn it on, it'll go for 45 minutes, turn off. It also turns out that if one uses it for 45 minutes every other day on a regular schedule, it prevents migraine. So it's FDA cleared for the acute treatment of migraine and the preventive treatment of migraine. And it's a non-significant risk device. It doesn't have significant side effects. And it's cleared for use in adolescents. It's actually been studied in younger children as well. And there's a hope that it'll actually get cleared for younger children as well. But right now it's cleared for ages 12 to 17 and then all adults for both the acute treatment of migraine and the preventive treatment of migraine. So this device is very easy to use and very discreet and very flexible in that people can use it multiple times a day or every other day preventively. Now, one of the disadvantages of it is it can only hold a certain amount of charge in the device. Each device has enough juice in it to treat 18 times, and then you throw it away. So it's not a rechargeable device, and they haven't been able to get more than 18 charges in it. Well, if you buy one of these devices, it has enough charge to treat 18 times. That's enough to treat every other day for a month for prevention and still have a couple of charges extra to use acutely. It does require a prescription. So that is the remote electrical neuromodulation device, or REN. The brand name is Nourivio. And we both, Dr. Ilani and I both find this a very, very effective neuromodulation device. So I'm going to go to two more topics before we start going to see if there's any questions. And the first and most important topic is cost. And I gathered the cost of each of these devices. Remember that if you're a veteran, you can get these devices through the VA generally in a pretty straightforward manner. There are a few healthcare systems that do cover some of these devices. University of Utah, Plan 32, which is a Tufts program in Massachusetts. There are just a few programs across the country that will cover some of these devices. And the hope, of course, is that we're going to get better and better coverage because they're so useful for patients. We'll start with Cephaly, the ETNS external trigeminal neurostimulator. the cost of Cephaly, remember you're going to go online to order it, and it does not require a prescription. The cost varies depending on the month. They have sales all the time, and you have to go on but the average cost of the Cephaly device, and remember it is rechargeable, is $400 one time to own it. Now, there are monthly payments available if you choose to do that. And the 3 electrodes, remember each electrode is going to last about a month. It's $25 for the 3 electrodes, and there is this 90-day return policy. So that's Cephaly. The cost of Headiterm, which is similar, is a rechargeable device, so similar to Cephaly, but only $99. No prescription necessary. And it's only $22 for the 3 electrodes. So Headiterm is less expensive, but remember it does not ramp up. It only has the 20-minute stimulation, and you set the intensity, but you can repeat the treatments with Headiterm, and it's rechargeable. And for that reason, both Dr. Ilani and I have been having a lot of our patients go to Headiterm rather than I don't know why suddenly there's a thumbs up next.
So, somebody like that. Yeah, we like it too.
Okay, now let's go over the ones that require a prescription, starting with GammaCore, NVNS. A 3-month starter kit for GammaCore, the non-invasive vagal nerve stimulator with the goop that goes on, is $450. And 3-month refill kits are $600. So $200 per month. And you can see that that's a significant outlay if you're not in the VA. On the other hand, TruVega Plus is $400 for the rechargeable device, so less for the device, and it's rechargeable. So you don't need the card, you don't need to keep paying for the card. So I can't think of any reason not to use TruVega if you are not a veteran. For the VA, you might as well go with GammaCore because that's the one that's been actually studied, but these devices are virtually identical. The Relivion device, the front-back device, the combined occipital trigeminal neurostimulator, is $150 for the first 2 months of unlimited use. But then, and here comes the axe, patients must purchase the device for $650. And you've only had 2 months to try it out as well. So that cost becomes very significant for a lot of people, unfortunately. Now, probably the least expensive, at least going in, is the Nourivio device, the remote electrical neuromodulation device. And that's $49 for the first device, which is 18 treatments. And then if you buy 3 devices, and 18 treatments you might begin to see benefit, by the way. It's $200 for 3 devices. So it's $67 per device in the packs of 3, about $67 a month. In the studies for Nourivio, it began to work in a significant number of people in 2 weeks, and it really worked significantly in 2 months. So you may know pretty quickly whether the Nourivio device works preventively, and of course you're going to be able to use it acutely. And then last is the STMS device and SAVI-DUAL, and that is $1,050 one time for 3 months, no refunds available, no sales, and $350 per month to rent. Again, available through the VA, but unless you're independently wealthy, it is not very affordable. So that's the bad news, all the cost of these devices. And it's really up to us as practitioners and you as our patients in our therapeutic alliance to lobby to get these covered by our payers because of how useful they are. They're so useful. And I wanted to finish by telling you all the different kinds of people for whom these non-invasive neuromodulation devices are appropriate. And some of what I'm going to say actually is from a paper that Dr. Ilani published in Headache, a consensus statement in 2021. So I use and recommend non-invasive neuromodulation to patients with an inadequate response to migraine-specific medication. We have people who don't respond to the new migraine-specific drugs, to the GPANs, to the monoclonal antibodies, and non-invasive neuromodulation can be helpful for them. We have people who have frequent migraine attacks and may be at risk of developing medication overuse headache or transforming into chronic migraine because of the overuse of the older acute medications, not the GPANs, but analgesics, anti-inflammatories, over-the-counter medicines, and triptans used too often can be associated with development of medication overuse and chronic migraine, and non-invasive neuromodulation doesn't do that. Some people don't want medication, and that includes a lot of young people who don't want to take any medicines. I remember in my office several weeks ago, I had an adolescent, and he had pretty frequent migraine, which was pretty disabling. And I started to talk to him about medicine, and I just got that teenager feel. And I said to him, "You don't really want to take medicine, and you're not going to take medicine, are you?" And he said, "No, I'm not going to take the medicine." But he was willing to consider Nourivio, and that was what we ended up prescribing for him. Those who have a history of poor tolerability with or contraindications to medicines. So if you have a lot of medical illnesses and the medicines that start to pile up and interact with each other, or you've tried a lot of medicines and they haven't agreed with you, non-invasive neuromodulation, very good in that setting. We use them on top of medication, so we can add them to an existing treatment plan. We use them in tech-savvy people who like to embrace new technology. We use those in planning pregnancy. The Nourivio device, while not cleared for use in pregnancy, had a very good study suggesting safety in pregnancy that was published last summer. And the SAVI-DUAL device is cleared in the UK for use during pregnancy. So those are extremely useful devices to try for people who are planning pregnancy or during pregnancy, although not technically FDA cleared for use in pregnancy. And for chronic migraine patients, so we use it early in the episodic migraine people who don't want medicine. At the other end, in chronic migraine patients for whom other options are close to exhausted and they've tried a million things, then non-invasive neuromodulation can sometimes be remarkably effective when we've picked the wrong targets for people. So there are a lot of people for whom non-invasive neuromodulation can be helpful. And I didn't even mention cluster and the trigeminal autonomic cephalalgias for whom these can be very helpful. So I want to leave on a hopeful note. There are so many people that can be benefited by these treatments, and some of them are reasonably affordable. I think it's a good time for us to go to questions. If you don't want to add anything, Dr. Ilani, but if you do want to add, please go ahead.
No, I think that was a really good summary and wrap up. I think, again, if you haven't heard about neuromodulation by your healthcare clinician, it really could be because of cost. It might be because they're not aware of some of these devices. They're often used by headache specialists, but sometimes I will tell you, I hesitate to bring it up in a person that I know is maybe having some financial difficulty or really struggling with copays for multiple medications. So sometimes you bringing it up can be really helpful, just to open up that dialogue and conversation, just to hear what the options are out there. I think that is a really nice way just to hear more about these options and what's available to you. Do we have any? I don't know if we have any questions. I see that some of them have already been answered, which is great.
So we're waiting for the queue. Do we have any questions? All right,
I will tell you, I thought, I can tell you what I'm often asked in practice about these neuromodulation devices. One is side effects, which generally are limited and rare. I would tell you all the TENS unit devices, the front back one, they tend to give you a buzzy sensation. The Nourivio definitely does that as well. The vagal nerve, sometimes people have a little dizziness, but otherwise not much. The other question I often get is which is the best one? And as you said earlier, there's not been a study that really looks at comparing them head to head, but there was an analysis done a few years ago looking at the acute studies and comparing the devices. And at that time, the Nourivio device looked like their studies had the best evidence. I do think we have a couple of questions now.
The first one was, are they safe with a brain shunt? And the one that I would feel comfortable using in shunt, this is up to you, Dr. Ilani, you might disagree, would be the Nourivio device. It's hard for me to think that would be a problem with a shunt. The other ones, I don't think I'd probably use in a shunt. Would you use Nourivio?
I would prescribe it, but here's the hiccup. When you prescribe Nourivio, they actually get a call from the pharmacy that ships it out, and they will hesitate to ship it out if you have something like a shunt. I only know this because this happened recently. I was not that concerned, but the pharmacy was very worried about it. So which of course, when the pharmacy is like, we're not really sure we want to give this to the patient, which made me then hesitate. And when I reached out, the company is like, we don't have any data. And that made me a little bit nervous. But I agree with you. I didn't think there should be any problem with a shunt or someone who had like a plate post-op, like a surgery for hemicranie after having a bleed. You know, these types of patients, I don't think there should be a problem because the device is so far distant and based on its mechanism of action isn't sending impulses up towards the brain, is doing something very different. But then we have this extra layer of the pharmacy step, and without that data, they make you a little anxious, and understandably the patient gets nervous. So I have avoided it really just for that reason. Once that question is put up, you get a little nervous after that.
The next question is, which are approved, actually they're cleared, not approved, but which are cleared in pediatric populations? Only 3 are cleared for ages 12 and above, and they are the non-invasive vagal nerve stimulator, the Gammacor, the single pulse transcranial magnetic stimulator, SAVI-DUAL, and the remote electrical neuromodulation device, Nourivio. And not one of these devices is cleared below the age of 12, although we hear through the grapevine that Nourivio may be submitted to the FDA for that population. And there is one case series by Dr. Andrew Hershey at University of Cincinnati Children's that showed that it appeared to be very effective and safe in the younger kids, but not cleared. Next question for you, Dr. Ilani. Can these devices be used for hemiplegic migraine?
So there's no contraindication for use of hemiplegic migraine. I was trying to rack my mind if I could think of, do I have any of my hemiplegic patients on one of these devices? I don't think so, but not because of lack of discussion, more because of they're doing well on some of the newer treatment options that are available to them. I wouldn't be that concerned about it, again, because it's working. In fact, if I were to choose one in the ideal world, if I wasn't limited by cost, the first thing I would think about was the STMS device based on the mechanism of what it's doing, which is resetting, cortical spreading depression really across the brain, which is part of the mechanism of how an aura, or I would think part of maybe what is happening in a hemiplegic event. And actually, come to think of it, I do have a patient who had very complex type aura with stuttering, speech events, then sometimes with a little bit of weakness after. And back when the STMS device was a little bit more affordable, she had that for 3 or 4 months, and she did really well during that time period. So I would use the devices for hemiplegic attacks.
Next question was, can you use the device alongside or on top of medication? And I did mention that. I said, yes, we do add it to medicines with great frequency, actually, just to give a little extra turbo, a little extra boost. The next question we also talked about, but I want to go over it. I want Dr. Ilani to address it again. What about use in epilepsy?
Yeah, so I would not recommend any of the devices be used if you have a history of a seizure disorder or epilepsy. Most of the devices, none of the devices were studied in patients with seizure disorders, and the fear is that it might, for some reason, activate an attack, even if you haven't had a seizure in some time. We just are cautious about it. And again, just to mention, it's very possible you have a history of epilepsy, it's been very well controlled, or you haven't had a seizure in many, many years and are off medication. Important to bring that back up. If you are considering a device with your healthcare provider, they might have forgotten or not known that you had epilepsy in the past, and you really should avoid these devices.
Next question is there any one of these devices in which people tend to stay with them longer, compliance or adherence being higher? There's certainly no data. There are some really interesting real-world evidence case series on Nourivio, on the remote electrical neuromodulation device, in which a very large percentage of people who use the device find that it is effective in more than half their attacks, let's say for acute treatment over time, or who use it for chronic migraine and have a gradual reduction in the frequency of their attacks down into the episodic migraine range. And it is very convenient to put it on and then put a shirt on over it and go about your business. And the other devices have little problems with adherence. The Cephaly and the Headiterm devices are cosmetically kind of odd looking to wear at work. The STMS device is heavy and you got to lug it around and have it when you need it. Plus doing it twice a day. It's very convenient to do the magnetic pulses, but it's not so convenient to be carrying it around. It's a little big for a pocketbook, let's put it that way. And the TruVega and GammaCore devices require the goop on the neck, and then each stimulation takes 2 minutes, and you do have to do multiple stimulations for prevention 2 or 3 times a day, and for acute treatment, sometimes repeating that in 15 minutes and 2 hours, for example. And so again, sometimes people don't stay with that. They find it too inconvenient. The Relivion device, again, during the day, it's somewhat problematic. It can be used twice a day at home without any problem, but carrying it at work and being able to turn it on for an acute attack, and it's only cleared for acute treatment at this point, is a little bit difficult. So of all of those devices, you can see why we kind of end up with the Nourivio device, because people tend to stay with it, except for the fact that it's $67 a month for the devices. Do you agree with that, Jess?
I do. I find it a couple of things interesting. I think devices are like vitamins. If you don't take them seriously, they're not going to work. And I have to remind my patients, you have to really think about that. Anything that has to be charged tends to be forgotten. So the GammaCore, the STMS, the Relivion, these things require charging over time, and patients tend to forget it. So I think in one way the Nourivio has the advantage is it's not rechargeable. Yes, that's not wonderful in the sense that you have to purchase new ones, but the charging, having to recharge, I mean, I don't know, lots of people forget to recharge their phones, but your phone is like stuck to you all the time. Whereas these devices, people forget to recharge them all the time. And then they have an attack and then need the device is dead, they go to their medicine, and it tends to get into this cycle. The other thing about Nourivio is that they actually did look at some of their data and show for acute treatment, you only need to try it 4 times. And if it works, it works. If it doesn't work. And so very quickly you get a sense this is going to be effective for me or not. So if you know it's effective, it's easy to carry, it doesn't need charging, it works with your cell phone. I find that that's probably why out of all the devices, people tend to keep with it. Whereas a lot of times the other devices, even when they were giving them away for free, people wouldn't even turn them on or charge them and then completely lose the free month, which I think was extremely frustrating, where we really haven't seen that problem with Nourivio.
Well, our last question is a very interesting one, is whether the devices can help with medication overuse headache. And the answer is yes. And I'll give you 2 examples and then turn it over to Dr. Ilani, see if she has more. In the regulatory pivotal trial of the SAVI-DUAL device, they included chronic migraine people, and we included medication overuse headache people. And we found that with 3 months of 4 pulses twice a day, a significant percentage of people went from chronic migraine to below 15 headache days per month, so to episodic migraine. And from medication overuse out of medication overuse. And some of that is because the STMS device can be used acutely. So people were using it instead of medication and using less medication. And I found in those days when more people could afford it, that it really did behave like an old-fashioned preventive medicine, that you had to do it for 3 months, and really it didn't kick in until the 3rd month preventively, and people had to remember to do 4 pulses twice a day. Now we'll sometimes have them do it 3 times a day, but it really worked like a good preventive medicine to get people out of medication overuse and out of chronic migraine. So in that prospective study, it really did show benefit. In the case of the Nourivio device, in the preventive trial for Nourivio, they had a study that was big enough that it looked at both episodic migraine patients and chronic migraine patients. And they were able to show that it worked in both. And so in the chronic migraine patients, again, it reduced the number of headache days, but it also reduced the number of days that people took acute medication. My feeling about these devices is that, yes, they can help in replacing acute medication, in reducing the need for acute medicine, in reducing the number of headache days per month, and I wouldn't be surprised if all of them work that way. Dr. Ilani.
No, I completely agree. Besides the limited evidence we have, the clinical aspect of when they're effective and they're relied on, and I've seen the same of when my patients find Cephaly to be effective and rely on it, especially the acute part of Cephaly, and use that instead of their acute treatment, they end up using less acute treatment, which helps with the medication overuse issue, and then helps reduce the disease burden, and then helps reduce all the abnormal signaling going on, but they're still able to treat their attacks. And then what they find is over time, they're having less attacks. I think it's when you find that right treatment and this duality of it can be used acute, it can also be preventive. This is really what I think helps people with that burden of disease and reduction of medication overuse headache. That doesn't mean that every device is going to work for every patient. It's really when a device works for you, it can make you achieve benefits in ways that other things haven't been helpful.
All right. I think we are at the end of our hour. We have somebody coming from AMF to bless us. Is that correct?
I believe so.
Absolutely. Thank you all so much for tuning in today. We are going to do a recap post on the AMF website. We will make note of all of the registrants for this one, and we will make sure that you get the link directly. And thank you so much. You all have a wonderful evening, and special thanks to Dr. Ilani and Dr. Tepper for providing us with so much vital information.
Thank you, everybody, for your attention. Have a good rest of your evening.
Thank you.
Have a good one.
Appreciate it.